3 trimester is something like that. So towards the EDD, they will go down. But sometimes baby can turn like that. Sometimes the baby also can turn like that. Stay here because why? The tummy is so tight. Sometimes the baby then cannot move, and the mother complains that oh my tummy is so tight, and sometimes I feel so exhausted. It's because it's not developed. The womb or the tummy is not expanding, so it got stuck because the baby also bigger. When the baby grow bigger and bigger, then no space for the tummy. Okay? So if like that stay, then she have to go for cesarean. Okay, if she have to go for like this, also she have to go cesarean. Sometimes they have low placenta that also cannot move also, got stuck. Low placenta is where we have blocking to the cervix. Alright, so assuming that if the baby is this one, second trimester, you can still massage. Even okay, assuming it is first trimester, you can still massage. Okay. So the motion is something like this. She got morning sickness, she has nausea, she have that, she have this.
呢一個係 BB， 即係幫個 BB 移翻仔個位。
Inside got baby.
Okay, so important is the sternum. Clear this part. Okay? Because when they eat sometimes she got no time to, she don't feel like eating. Sometimes first trimester she want to eat a lot. The craving is so much. Okay, so here.
Same liver,
Same thing,
sama.
yeah. Okay. Okay. Just
Slightly.
lightly, yes. Number 1.
Yes, master.
Again like that, slowly. Okay. Again. Now, you want to loosen up or to give better environment inside. You just have to do just rock lightly. Okay. Not like that, please. Okay. No, like that. Just lightly. Okay. Just loosen all this tightness. And then the same method.
Kalau 20 weeks pun sama juga. So kalau 20 weeks pun sama juga.
20 weeks is how many weeks? How many months already?
5 bulan.
Dah 5 bulan. That is second week, the second trimester already, right? So the second trimester is a little bit bigger. Okay, assuming that is very big.
Tu. Mangkuk tu.
Mangkuk tu dah 3 bulan. Dah cukup bulan.
Oh, mangkuk.
It's cukup bulan. Okay, so something that is depending on how right the second, then go up. So you have to see the graph or the baby expanding or the tummy expanding. Then you can do also the same thing, but this time is you have to do a little bit of back because she had suffered backache already. Heavy. The baby is growing, so just more.
Tapi tak terlalu kuat sangat lah.
Yeah, just at the back. More pressure on the back. Okay. Lima bulan kan? So
5 bulan.
do that. The same thing. Only the pressure. Understand? Sometimes you can feel the baby jumping here and there, especially third trimester, right? And then you can also feel that why I can feel two balls. Okay? Assuming that usually the baby is like that, right? Right. So this is
Bentuk dia.
buntut. This one is the butt, and this is the
Head.
The head. How are you going to identify the head and the butt? Because inside is round. This one is round, 2 balls, you see. Yeah? So you have to find. Yeah? By the third trimester, you already know. Yeah? Because it will maintain the position, but slowly they will shift. But second trimester difficult because it's still small. Okay, so assuming this one is third trimester. then you can feel that the baby is this position, okay. Then you can see the balls here, and see another balls here. In your mind, you must know that the head has to go on this side. Unless if the baby, if the pregnancy is this posture. But you can see how you have to identify which one is the back, which one is the front, because the back usually nearer to the heart and it keep it warm. Right? So if the baby is like this, you feel that this part is warm. But here, you away from the heart, more a lot of heads, the legs and the hands, so you can't feel warm. Because sometimes you feel cold. Okay? So when you have this, then just do slowly. You just shift, just like the same thing. Slowly, scoop this side. Okay, you have to scoop. Give more space. Give more space. Okay. At the same time, loosen up this area, the diaphragm. Okay. Loosen up. Sometimes the membrane got stuck. Okay. Also the same things on the pelvic. Slowly. Okay. Not too hard, just gentle. Sometimes it's too big. The tummy is so hard, then you just pulse. Do a lot of pulse. Loosen up. Okay. That goes to this side. Okay. So you have to do the same thing, and then rock and rock. If you think that the tummy is too hard, also still hard, just lift up. Align the pelvic bone. Slowly.
Itu dah berapa semester? Second?
Normally third lah. By the time the pelvic is expanding, the baby is bigger, then you have to loosen up. Sometimes you can shake. Loosen up. Loosen up. And because she is sitting a lot, she been walking a lot. Okay, now it's really loose. You find that it's loose. All this loose and loose. Now the baby is still bridging. In terms of bridging, it's like that. So you have to see the butt is here and the butt is here, and the head is here, or maybe this part, or maybe this part. This one is easy lah. The baby can move, but if like this, now how are you going to address? Assuming it's like that, it is the head. It's the head. Okay, right? This is the butt, It's bridging. So what you do is you catch the butts. Okay, and you catch the head. Scoop. Okay, when you scoop, breathe in. I have to breathe in. Okay, to get the energy. Okay, and shift like that. Okay, and again roll back. Then you see, loose or not. If not, you only can do actually one time, depending on the tummy. Sometimes very tight, Again. Yes. But you must catch the butts and the head. Otherwise, you cannot the baby cannot follow you, and it cannot go towards the gravity, because it has to go to gravity to.
Feel which one is the butt, which one is the head.
That's why I said over here usually is warm lah.
Oh, kalau panas tu kepala.
No, badan belakang.
Badan.
Behind, back.
Behind back. Terasa lah.
Yes.
You feel. Kalau cool maknanya bukan.
No lah, this part lah. Depan mana panas, it's not hot. Only at the back. Okay. So when you do, once you have shift, and then you can just do and then do the rocking. Okay? But sometimes if you are there, because I don't think you are there, for me sometimes I have to scoop harder. Okay? You see? Sometimes I can just push. This is your expertise lah, you know. If you are not trained, better don't do. Okay? Yes, I will scoop the baby and push. Because inside is water only, what? Right? Just push. 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 Okay? I have to be very, very careful, right? Usually at the back, towards your back, spine, then you scoop. Because you know the amino acid, the things is like a ball. So you really need to scoop right at the back and shift for the baby. You get it? So as and when you practice, you know, you adapt to this skill, then no problem. But initially, try to do lightly on the first trimester, not the third trimester. When it comes to third trimester, if the baby is still bridging or your tummy is still hard, I will teach you, I will guide you different ways. Where we do the bozo, shake the butts. Okay? We do one at a time. Okay? So now we work on this one, the prenatal. You work on the backache and sciatica. If you want to, the most common is what? Nausea, right? But sometimes not many people understand about early pregnancy problems. Right? Maybe you can waive that one. Okay? Nausea also out. Maybe constipation, at the same time when you had your constipation, you just have to press this area. Even though it's
Prenatal pun boleh? Prenatal also can?
Yes. We will show you. They will do. On the pressure dia more to pressure points. The bladder. Okay, so the egg, sciatica. What else? What else? Let me see. You want that one? It take a while.
Want to see the menu?
Yeah. Okay, assuming that she have leg cramps, there are a few types of leg cramps. This one is only one type, but I will show you this one. You can see this one, and I will do another one along the way when you do the foot massage. Massage, Okay, assuming that I complete, right? I didn't see this one. No, I don't see it in the sprint.
Yeah, I don't know why.
Tak on ni?
Okay.
Macam tak on ni?
Okay, on and off lah.
Tak ada orang kat luar?
Yeah. Okay, leg cramps, you can see.
Leg cramps is another common complaint in pregnancy,
Okay, you
especially
stop
as
this
the
one
pregnancy
first.
progresses into the
I will
third
show
trimester.
mine. Very simple also. Just lift up. Once you have finished all the fingers, and you have catch the tendons, okay, then oi, don't sleep You are learning, you know, you are not sleeping, you know.
I dengar tapi macam
Jangan kau punya dengar Bukan
Tak
tegur.
saya dengar.
You are snoring, you know.
sorry
And then what?
Tapi otak yang tak kuat dah.
Okay. Then you sit on the legs.
Boleh
Yalah, snoring so hard lah. Then what? Dah tap you. Okay, you sit so that she will don't flung the feet on my face.
So
水肿，
Okay.
水肿。
Just relax. Slap. Relax the calf. Left, right, left, right, left, right, left, right.
เท่ากันเหรอ
You twist.
เท่ากัน
จาก
เนี่
ส
ย
ลับกัน
Huh?
Sorry I say Cantonese
Slap, 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 slap. Then at the center of the calf, catch the center one, then you lift up. Okay. Center.
Macam yang
Okay.
Urat tengah tu.
Okay. Okay. You relax. Okay. Very slow. And this one. On this one.
And many women, including Gina, experience leg cramps in the calf area
So you can
in
do
the
also
middle
like
of the
that?
night, often waking them up.
Usually at the back, right? Or the
If
side
mom
way.
happens to get a leg cramp while you're working on her and she's on your table or you're with her at any point, they often occur in labor also. The first method to deal with it is actually to put her foot into
So you have not
natural
video,
flexion position,
no video
uterus
yet.
flexion. It's most effective if it's done passively. So Gina, rather than you helping me flex your foot, you just let your foot be relaxed and I'm going to do the flexion on your foot altogether. So putting it into a flex position helps gradually to relieve the cramping. But there's some acupressure points that are also helpful and effective in relieving the cramp while it's happening. And also these points can be used at other times when it's not an acute situation to help prevent cramps from happening. So the first point is called bladder 40 in acupuncture, and it's directly behind the knee, right in the center, in the midline of the knee, between the tendons, right in the back. So I'm not going to press real deeply or firmly there. I'm just going to hold the pressure.
one?
And at the same time, I'm
When you
continuing
do
to
the
hold her foot in
uric
a
acid,
flexed position.
Rina, these
I'm
are the
just
lot.
going to hold
It's a
there
big,
for
call it bladder.
up to a minute or
Then
so.
the
And then I'm going to move to a point
center.
into the center
You can
of
really
the
lose your
gastrocnemius. So
attention.
right into the center of the belly
Like
and
you
the muscle
do
of
this
the
one.
gastroc is
And
another
clean up.
bladder meridian point.
Yeah, and this
And I'm
part.
going to press in there
This
very
one.
gently and slowly.
For
If
your
her
knee
muscle is
problems.
actually cramped and very tight right now, I'm just going to apply
So
my
you press,
pressure and just
you
very
press the
slowly,
center,
gradually
at the center
into
of the
cramp.
calf.
Yang tadi tu.
It may be a little uncomfortable, but the cramp
Yeah,
itself
because
is
maybe,
excruciatingly uncomfortable. Another acupressure point that's specific for the cramping is
That
found
will
right
last
at the
that way,
body of the gastrocnemius.
B4, A40, 56.
So I can slide up into the V of the gastrocnemius and hold another point there. And again, still I'm holding her foot in flexion. I don't want
So,
to petrissage or massage
next
or
one
do
will be-
manipulations of this
Okay,
muscle
that one
when
now,
it's cramping or
the last one where
after
you
it's cramping,
open up the
because
legs,
it causes
that one will be the last
So
one.
just holding the flexion,
Okay,
dorsiflexion.
so we do the practice one first. Can do the practice now? We have one session.